friends, and I'm back with Dark Circle Part 2. That is the actual procedure of filler injection for lower lid hollows, what we call as tear trough. So we should first understand that the face is a very vascular structure. There are a lot of blood vessels in the face, and it needs a lot of expertise for you to do the injections and prevent the filler from entering into the blood vessel and causing side effects. And therefore, in the areas that are very vascular, where the blood vessels are much more, we like to use very blunt tipped cannulae. Now this cannulae does not have a sharp tip, and it has an opening on the side, so that even if you are near a blood vessel, it's not going to poke inside the blood vessel and the filler will not enter the blood vessels. It's relatively safer compared to needles. When we use needles, we try to choose a plane which has less blood vessels, so that we have less chances of injury to the blood vessels. So this is the basic concept, and that you will see in today's video, that in areas where we expect big blood vessels, we are using cannulae so that the safety is adhered to on the face. Now when we come to injections, what we follow is that all the injections on the outer side of the face, like on the temple, on the cheekbone, or in the area before the ears, and also on the angle of the jaw, all these areas, whenever we give fillers, it tends to lift the central part of the face. So the fillers which cause a lifting effect, we use on the outer side of the face. That kind of supports the front portion or the mid portion of the face. So those are the initial first injections that we give to kind of cause a structural base, on which then we do further contouring and volumizing that we need. And whatever injections we give in the central part of the face is to add volume or to add contour to the face, and that's what you see in this patient. I have marked the lid cheek junction. I've also marked the temple point, the high cheekbone point, that is on the zygoma, where you want the maximum elevation or the top model look. And I've also marked in the area which is in front of the ear to lift this nasolabial fold like this. If you lift, this fold gets relatively less prominent, and then also the jaw, which I have not done for this patient, and the chin point. So basically, as I had mentioned in my previous videos, if you have a good proportion between the 3/3 of the face, you have a very good cosmetic result. Now another point is that these injections are very fine injections, and they are done after using surface anesthesia, and therefore they are not very painful. Though we are giving so many injections on the face, if you take a patient's review, it's not very painful. There is no downtime, because as soon as you do the injections, you can see the effect, and they give a very good rejuvenated lifting effect to the overall face. They are much better than fat injections, because here we have more choice between what products we use, which areas you want to have maximum effect, and what kind of effect you want, whether you want to lift or you want to volumize or you want to rejuvenate. You can choose different products and have different effects, and therefore I prefer fillers to fat injections for the face. That's all for today, and I'll be back with the next series of surgical patients, where we will see a series of surgeries which we use to rejuvenate the face. Thank you.